Cardiovascular disease kills 6 times as many women as breast cancer.
Cardiovascular disease kills more than 500,000 women a year.
Cardiovascular disease kills more women than men each year.
1 out of every 2 women will die of cardiovascular disease.
When I was first diagnosed, when I first heard the word heart disease was actually when I was on the table having an angiogram, and I was told that I had 80% cholesterol, a blockage in my artery, and I was in shock.
I never even gave my heart a second thought, really. I felt that I didn't have any symptoms of anything. I never woke up with headaches or dizziness or feeling tired and fatigue all the time. So I didn't go. I thought I was okay. But actually, I wasn't okay.
I know my body really well, and I knew the symptoms I was having were real. I was having the chest pain and the squeezing and the radiating and the jaw pain.
I started feeling pain shooting down my arm, actually both arms. I was shortness of breath, my teeth and jaw started hurting. I started having headaches, and I spent probably a few hours going through these symptoms before I finally had a girlfriend tell me that this was not something to take lightly.
I was the one that didn't want to go to doctors. I just stayed away. I know that I should have gone earlier, sooner.
I had these symptoms from the time I was in my 40s, and I worked in the healthcare profession almost my whole entire life, and even that didn't get people to take a notice and listen to me.
Heart disease was always associated with age, being older. All the characteristics of someone with heart disease was someone like my father.
One of the major myths of heart disease is that it's a man's disease. It's a middle-aged man leaving a business luncheon, carrying a heavy briefcase, going out into the cold, clutching his chest.
Not only is heart disease not just a man's disease, it's not just an elderly person's disease, and heart disease can happen to young women as well.
It doesn't matter how old you are, it doesn't matter where you come from, what your background is, it's something that can happen to you.
One of the things that can be really important for all of us is to listen to our bodies. You have to listen to your body when you have a symptom, and to not be avoidant of whatever that is.
Women's symptoms can be different than men's symptoms, and this can make it difficult to diagnose women.
The main one is chest discomfort, but it doesn't always come as a chest pain.
It's often a heaviness, a squeezing, a tightness in the chest, and it may radiate down the arm, up into the jaw, or into the back.
Women also present with symptoms that might be put off as premenopausal. So they might have some shortness of breath, fatigue, not sleeping well at night, indigestion.
One of the problems that often happens is that when women present with symptoms of a heart attack or symptoms of having cardiovascular disease, they can be misinterpreted as anxiety. So one of the things that we want to help women do is accurately identify whatever symptoms are coming from their own body.
At the time I thought I was having an anxiety attack. I tend to put a lot on my plate and take on too much, so I was brushing it off as if it was nothing. And it wasn't until I got to the hospital and they started running tests and doing EKG that I started taking it seriously.
Stress for me is probably the key component for my angina, my heart. So I've had to learn to step out of my type A personality, and if the beds don't get made or whatever, it's okay. If I don't make homemade cookies that day for my kids, it's okay.
Oftentimes women put everybody else above themselves, and they're the last person that is on their priority list. And I would really like for women to start putting themselves first.
It's important for every woman to know her risk factors and then do the things that she can to reduce her risk factors. Some of them are not modifiable, such as our age or our family history of heart disease, but most of them are modifiable, and those include having high blood pressure, having diabetes, having high cholesterol, smoking cigarettes, being overweight, and also not exercising.
One of the things I find most hopeful about being in preventive cardiology is that this is a preventable disease in many cases, and that people can really make a big difference in their lives by changing their lifestyle, especially through diet and exercise. And I think a lot of women feel quite empowered and encouraged when they see that little changes that they make in their life make a really big impact.
While we've come a long ways in treating women with heart disease, there's still a lot that remains to be done. Heart disease is something that we all need to be concerned about, and we need to talk to each other about it. It's not something that we should hide or think that doesn't apply to us.
The more information regarding your health, the better off you'll be. Ask your physician for your numbers. You should keep a record and know what your blood pressure is, what your cholesterol is, and what your glucose is. I'd like women to internalize this information that cardiovascular disease applies to them and not someone else.
If I had seen a video come across my email, or if I was surfing the website, I would have never clicked on it. And primarily the reason being is that it didn't apply to me.
Anybody that's clicking on this or is watching this, it's really important that you pass this message on. Until she had the heart attack, nobody took her seriously. So it's really important for your health and the health of either yourself or your spouse or your loved one that you pass this message on.
I just want to say thanks to my mom for her inspiration. She's been great, motivational, encouraging me to exercise as well as eat healthy, making more appropriate food changes. Heart disease was not on my radar, but it is now.
Share this message with friends and loved ones because it's a really important message to get out. Whether you want to use social media, the web, word of mouth, whatever it takes, please spread the word.